Welcome, everyone. It's Tuesday, so you know what that means. It's On Point with Dr. Pam. Today, I have a very special guest. Her name is Christi Chapman. She has over 2 decades as a respiratory care practitioner. She's served in a burn unit. She's helped patients with lung disease and so much more. And her journey with her own illness led her to create and formulate with a team very special products. And it is with this, it's my honor and pleasure to welcome Christi Chapman. Hi, Christi.
Good morning, Pamela. Thank you so much for having me.
Oh, I feel like it's timely, right? I think people, if they'll open their minds and hearts, because some of what you may talk about today, people may have some misinformation, but if they lean into your expertise and your journey and your formulated products, I can't wait to see what can happen. And with that, Christi, I want to open it up and have you tell us a little bit about your background and your journey.
Thank you, Pamela. What a beautiful introduction. My journey has been as a respiratory therapist, 30 years. I had a family member who I saw a lot of illness, and it gave me the desire to help other people in that position. So I worked in, as you said, the burn unit and open heart unit, pediatrics. I worked at a teaching hospital for years. So to my surprise, when I got ill and the doctors wanted to put me on their regimen, I just knew that it didn't work for me. I knew the future that offered. And so I needed to, as I like to say, grab the plant by the molecule and figure some things out. We have a choice. We have opportunities to live a different life nowadays. So my journey in having pain issues and formulating topical products that are award-winning to alleviate the opiate situation in my personal life. So it's become a very personal journey of health and wellness and how I've gotten to where I've been able to be. So my hope is that people will do the research, not have fear, and listen to the facts, listen to the science, and choose how you want to live your life.
Thank you, Christi. I know you're making a difference in people's lives, and you want to lean into a little bit. I love that phrase, grab the plant by the molecule. And maybe I should set it up maybe a little bit for people. Christi's going to go into a little bit about plant medicine, but let's have your expertise let our audience know about this grab the plant by the molecule.
Well, so many people have been afraid of the plant, and the community that I'm from certainly has not been plant friendly. When I started reading articles about how each molecule does a specific thing in our bodies, regulates, brings our bodies into balance and homeostasis, those are the healing things that our plant can do for us. This plant can do for us. So when you grab that molecule and you solve a problem, that's a good thing. So I also would just like to say that it is my belief that whole plant is the healthiest, quickest way to health. Now, not everybody can have whole plant. I have multiple people that I have treated. Actually, I just lost a patient last week. It was my pastor's father.
Oh, I'm so sorry.
Yeah, it was very beautiful. He was in his 90s, had a life of service and loving on people, and so it's a celebration. My point being is, when I went to his family about options while he was in hospice, they were interested in whole plant, but they were already in a difficult situation, if you will. So to make that jump to, we don't want to get him high, I was able to say, well, there is parts of the plant that can help relieve issues. So grab the plant by the molecule. If you have to grab a molecule that solves a problem, grab it.
And let's tell our audience.
If
What were you
you
going to say, Christy?
if you can have full plant, your healing will be faster.
Okay. And let's make sure our audience knows what plant we're talking about.
We are talking about the cannabis plant. Yes, I forgot that part.
That's
The
okay. No. And listen,
the plant
here's
that heals, the plant that we are all researching and finding out incredible testimonies of healing and people getting well, and stories of nurses giving patients CBD in large doses, THC in small doses for the nighttime. And those patients are coming back and reporting with their physician that they are actually in remission. So there is a group of us that have seen just some incredible healing. One that comes to mind that I would like to share is a very dear friend of mine. I won't use names right now, but a dear friend of mine had a horrific wound that they were actually going to take part of his hip and rebuild his elbow. Had visiting nurses come in, and I kept walking by and watching the nurse. And I kept thinking, I know this plant can do amazing things, but, this is a really serious situation where it could be surgery. I certainly wouldn't want to throw him into sepsis, or, we don't put topicals in wounds. I was able to get with a team. We got some wonderful medicine that had been third-party tested. And in fact, we were able to close that wound. Now,
yeah, and let's dig into this a little bit, because this is part of where I think people have some misinformation. You don't have to, like when you say grab the plant by the molecule, you don't have to grab the whole plant. That may make someone feel altered in some way. The plant has benefits, and it's my understanding, see if this is accurate, that plant actually has receptors in it, and those receptors are found in the human body.
So our bodies have receptors that absorb the molecules, absorb the plant, absorb the flavonoids. The cannabis plant has so much to offer, so much healing, that we keep learning more. So what happens is when somebody inhales, pardon me, part of the plant, and there are so many molecules, and we're finding so many more. There's THC, CBD, CBG, CBN, and we're finding that THC is great for pain, CBD is great for inflammation, CBG is great for pain, and CBN is great for sleep. And so when we're able to actually make a formulation that helps somebody with what they are struggling with specifically, then we do not have to enter the psychotropic, if you will, part where so many people choose not to go. A lot of people do not care for that. So we are able to grab the plant by the molecule and do some formulating. And I would like to share too that it is very important to have an entourage effect, we call it, in that one drives the other. So CBD with CBG drives it into the body, into the receptors that we spoke about, the CBD1 and CBD2 receptors. Most of those are actually found in the brain and in the gut, the two places that we need healing the most. So, so it's important to fill that endocannabinoid system to bring balance into your life, bring balance into your body, so that we can have balance in our life. Interesting fact is our endocannabinoid system is so empty. I won't go into the long journey, that's another show, but our body requires that. And we have been starving it. So that is just my opinion and why we have so much disease. We have been not feeding our bodies what it needs.
Wow. And let me ask this question. It seems like with your background in the respiratory areas, are you finding that people are using and grabbing these plants by the molecules in these medical settings to help patients?
That is what a lot of people are working for. A lot of medical professionals really recognize the studies and the work that has been done to prove. So we are having an awful lot of healthcare providers stepping into our space and helping out, doing the educating. They see the benefits of it. It's really hard, Pamela, when you're offering patients a different way and their outcome is better than you could even anticipate. And certainly we don't promise anything. It is a case by case, but the research is there. The stories that we are witnessing are there. And so this cannabis plant has a lot of us leaning in and healing in a new way.
Right. And, you know, it's my understanding that I think it was in the 20s and 30s. I don't think the audience is aware that pharmacy used the plant. And I know that's not the focus here, but I since learned that you can't patent a plant. And so then I wondered, just thinking critically, I wonder if that's what stopped that trajectory, right? If you can't patent the plant, then could pharmacy make money? But I want to lean in. Those are just my thoughts thinking critically. Do you want to comment about any of that, or you want me to?
Oh, you don't even want to get me started on that.
Okay.
No.
Oh, okay. And I'm not sure,
Wait,
you know.
I will just say that it is so sad that at one time in our society, in our towns, in our communities, it was required that you grew hemp and tithed enough to your community so that everybody would stay healthy, that there would be ropes, that there would be all of the products that hemp makes. So when some greedy people came along and recognized that they could make money in big pharma in ways that would hurt people, and they knew it. See, that's where you don't want to get me started. They knew it. So for us to stand strong and demand that we reverse it, that hemp is back in our diets, back in our medicine cabinets. You know, they had compounding back in the day. They knew it was medicine, and we know it is today too. So get myself back on that good path, because yeah, that is one of a subject I don't like to.
Okay, we could dig into that on a different time. Yeah, I'm aware of that hemp rope and all of the products that people made from the plant. And then I was taught that a chemical industry came in and created a synthetic version, and then the hemp rope, which was strong and viable and sustainable, went by the wayside. Again, I don't know if I have complete accurate information, but anyway, so let's move on. So what were you going to say?
Fun fact about hemp rope is it is the only rope that will not burn.
Wow,
now,
I didn't know that.
Why would they take that away? Why?
Wow.
So this is the reason why activists get so powered up and so willing to try and right a wrong.
Wow.
Hemp
I learned
rope
something.
does not burn. It is the only rope that will not burn.
Wow. Okay. I should have a banner that says "fun fact."
I should do a little fun fact moment on your podcast.
Okay. Oh man. Okay. So let's lean into the respiratory care, your background, and then let the audience know how you came to formulate this product that can help people with breathing. Do I have that correct?
Yes, you do have that correct, Pamela. Let's see, I'm trying to think, do I do the long version or the short version? So my story is that I found topicals and they were a solution to a problem in my life and in many people around me. So during that time, I ended up with more health issues, and all I did was read. I love to read. And I came across what the molecules in that plant were doing. And I found out that CBD, in fact, was a bronchodilator. And being a respiratory therapist, I just dove in, and 7 years later, actually, 5 years since I started the company, but have been interested in it for 7 years. And so when I found that CBD in a metered dose inhaler was a better bronchodilator than the medicines that I had been giving patients for decades that would give them an increased heart rate, nausea, sometimes vomiting if they had to have higher doses, but yet their breathing was okay. And so that was what we were there for. So it was a difficult situation. So as I'm reading and finding out that CBD decreases nausea, decreases increased heart rate, increases bronchodilation in the lungs, and when I found out that, in fact, when measuring it on a flow loop volume, which is the respiratory therapist, we get to have devices that measure volume going in and out of the lungs in certain, we have different tests that we do. So when we use those flow loop tests, those tests even showed beyond a shadow of a doubt that CBD was in fact decreasing inflammation in the lungs and opening them up better than the bronchodilator that I was using in the hospital for patients. So I had to get busy. I had to get real busy. So I have a sign in my office that says I want to change the world. And if I can just change what a patient gets offered when they need medicine, that my job is done.
Right. And then
I
feel like your work is so important too, because it's part of that educational campaign. It's part of educating people so that they know, one, their options, and two, if there are options that have less side effects, right? And work that can promote or improve overall health and wellness. Now, do you want to speak a little bit about your product and how people can get in touch with you? And if you want to, I know you were involved with other nurses. If you want to speak to that a little bit too, that was very exciting.
I just am very blessed. This journey has allowed me to meet some amazing, amazing people. We have collaborated with the Green Nurses and Holistic Caring. They're a wonderful community that is full of education where you can be certified to help other people. So I'm always interested in sharing holistic caring and Green Nurses because they educate. I feel that my job is formulating and getting products to market. That is a full-time job in itself. So collaborating with people who are like-minded have served our purpose very well.
Well, I want to thank you for this very important work. And I want to encourage everyone to reach out to Christi. Christi, the contact's on the screen at chapmanhealthandwellness.com. And I know Christi would answer your questions, help you to understand the products and their benefits and uses.
Absolutely.
Is there any final words you want to tell our audience, Christi? I'm so glad to have you. Your work is so important.
Oh, Pamela, thank you so much. It's just a matter of wanting to allow people to live a better life. That's all it's about. So if anybody has a desire, please feel free to contact me. I can steer you in the right direction, answer questions. Our products are available on our website, and we are just here to help people understand all the molecules in this beautiful plant that we have to heal called cannabis.
Thank you, Christi. I really appreciate your time today.